Welcome to the Deep Dive. Today we're tackling something really important for understanding heart health, especially when things seem fine until they're not. We're talking about stress echocardiography. It's about seeing how your heart really works when it's under pressure. Our mission, to break it down for you what it is, why doctors use it, and what it actually tells us.
Exactly. It's a fantastic way to see the heart when it's genuinely working hard, not just sitting at rest.
We'll cut through the medical jargon today, hopefully making you feel much more comfortable and informed about this test.
Okay, so the heart under pressure, that's the central idea. But let's get specific. What is a stress echo, fundamentally? Right. So at its heart, pardon the pun, stress echo combines two key things: ultrasound pictures of your heart and stress. Now, that stress can be from physical exercise, usually, walking on a treadmill. Or sometimes it's induced with medication that safely makes your heart work harder, simulating exercise. We take pictures when you're resting, get that baseline, and then we take another set right after you hit your peak stress level. The whole point is to compare, to see how the heart muscle, the valves, how they all respond when the demand goes up.
So it's the comparison that's key.
Precisely. A resting echo shows you the basic structure, sure. But the stress echo, well, it's designed to uncover those hidden issues. Things like subtle drops in blood flow, or maybe a valve problem that only really shows up under strain, stuff you just won't see when the heart's, just coasting.
That makes sense. So these hidden issues, what kind of symptoms usually lead a doctor to say, okay, let's do a stress echo?
Good question. Often it's things like chest discomfort, maybe shortness of breath, but specifically when you're active. Or sometimes just unusual fatigue that seems linked to exertion. You feel fine sitting, but wiped out after climbing stairs, that sort of thing.
Right, the classic, it only happens when I move scenario.
Exactly. And it's really valuable if there's a suspicion of coronary artery disease. Because, again, it's looking at function under stress, not just the plumbing at rest. It's both diagnostic, finding the problem, and functional.
Yeah.
It helps figure out, are these symptoms related to the heart? What's a safe level of activity for you? And it guides what comes next. Maybe it points towards needing different medications or perhaps more invasive tests like an angiogram to get a direct look at the arteries.
Okay, so let's walk through it from the patient's perspective. If you're scheduled for one,
Right.
what's the experience actually like? And what are the doctors zeroing in on?
Sure. So first phase, you lie down, nice and relaxed, and we get those resting ultrasound images. Pretty straightforward. Then comes the stress part. You'll either hop on a treadmill, we start slow and gradually ramp it up, or you'll get medication through an IV to get your heart rate up. And immediately after you stop exercising or the medication peaks, you quickly lie back down and we get the second set of images. That timing is crucial for the comparison.
And safety-wise, people might worry about stressing their heart.
Understandably, but it's generally very safe. You're monitored constantly, ECG, blood pressure, symptoms by trained staff the entire time. We stop, if needed, of course. What we're looking for in those post-stress images, well, a key thing is called regional wall motion abnormalities.
Okay, what does that mean in plain English?
It means a specific part, a region of your heart muscle, isn't squeezing or moving as strongly as it should, only when it's under stress. If an area looks fine at rest but then struggles during stress, that strongly suggests the artery supplying that area might be blocked or narrowed, is not getting enough blood when demand increases.
Ah, I see. So it pinpoints the problem area.
Exactly. We also look very closely at the heart valves. Does a leaky valve get worse with exertion? How well is the heart actually pumping overall when pushed? These are dynamic changes that a simple resting test, it just can't capture.
That dynamic aspect seems really central. So, compared to other common tests, maybe a resting ECG or even a standard echo, how does stress echo really stand out? Why should you, the listener, really grasp its importance?
Yeah, that's the critical takeaway, I think. Unlike those static tests, which are like taking a photo of your car parked in the driveway, a stress echo is like taking it for a test drive up a steep hill. It shows the heart in action, responding to demand.
A much more realistic picture, then.
Absolutely. And that makes it incredibly useful for catching cardiovascular issues earlier, sometimes before they cause major problems. It lets doctors understand your actual risk level much better and tailor a plan, whether that's treatment, monitoring, or lifestyle changes based on how your heart performs in the real world, not just in theory.
So wrapping up our deep dive today, stress echocardiography really emerges as this safe, effective, and frankly quite insightful tool. It lets us see the heart's response to stress, catching things that might otherwise stay hidden.
Definitely. And if you, or maybe someone you care about, is going for this test, Hopefully understanding why it's done and what it shows can make the whole process feel a bit less daunting. And maybe it leaves you with this thought. How much more do we learn about our health, about our bodies, when we look at how they respond dynamically under load rather than just seeing them at rest? What else might we be missing?